We never think about walking until it becomes more difficult. For people with health conditions that limit their walking, where others see a staircase, they see a mountain. Our ability to walk has a big influence on our life. It can be an indication of how healthy we are, or how much a given condition is affecting our daily life. However, right now, we have no way of measuring walking outside of the hospital or the doctor's office, which only give a brief snapshot of progress. Being able to measure how well someone can walk on a normal day in the real world would give healthcare practitioners, clinical trialists, and drug regulators better, more accurate insight into how someone's life and walking is affected by their condition. This is where Mobilise-D comes in. Mobilise-D is a research consortium that is using digital technology to improve the measurement of walking performance. Partners from 34 top universities, hospitals, and global industries are working together with patients, practitioners, and industry experts to develop reliable measurements of real-world walking performance, such as how someone walks or their walking speed. A recent Mobilise study looked at all the existing evidence about people's experience of walking with different mobility impairing health conditions. The evidence points to walking as a complex and important aspect of health and quality of life for those living with these conditions. The impact on mobility is not condition-specific. People with diverse conditions from COPD and hip fractures to Parkinson's disease and multiple sclerosis experience similar changes to their walking. Walking is also more than just physical movement. Results showed that walking is an emotional, social, and physical experience. A person's walking can change depending on the weather, terrain, how much energy they have on a given day, and also whether they're out and about or relaxing at home. Not being able to walk as far as they would like to, or without symptoms, can limit a person's abilities and ultimately affect their sense of identity and well-being. Things like being able to socialise, do their usual daily tasks and physical activities, or look after themselves or their families. These complex experiences of real-world walking highlight why new measures are needed. Measures that assess a person's walking when impacted by daily life and its environmental and psychosocial factors. These improved measurement tools will be used in future research to explore the best treatments and therapies for each person. Better ways of measuring walking will eventually enable healthcare practitioners to better support patients with their walking, researchers to explore better treatments for walking impairments, commissioners and regulators to fund better research to better evaluate walking, and most importantly, improve people's quality of life.